Hey guys, Kyle here. Listen, wanted to be able to start to give you guys some stuff to work on. I've had a few conversations with some of you guys, some of the community members here recently, and I wanted to give you guys and empower you the ability to start tackling any sort of pain or weirdness you guys are finding as you get into trying to move better. We can only move to the best of our the level that our tissues health is at and kind of how our bony structure is aligned. And so ways that we attack that commonly, we don't call it stretching. Stretching is just kind of like a passive, non-engaged way of lengthening certain muscle tissues. But what we want to do is we really want to attack mobility. And again, mobility now is being able to remove any sort of limitations that prevent full range of motion either at a joint or within a tissue range. So first thing I wanted to start with, have had a couple of members talk about plantar fasciitis. And plantar fasciitis, guys, really just refers to any sort of issue that takes place on the bottom of your foot. Okay, so what we're looking at, let's see if I can do a little bit better here. What we're looking at, guys, is again the plantar fascia, right? Kind of starts as like this kind of small triangle and then comes up to attach to the metatarsals here. And what can happen is we have either problems where this toe is always up, like if you're wearing flip-flops, which you shouldn't be. Athletes don't wear flip-flops, but this toe can come up and that can create some extra tension here. And so if you're doing a lot of plyometrics or foot strike type activity, you can just really pound on these things. And think about how much time you spend on your feet, right? This stuff effectively becomes like matted down plywood. And when that happens, and then we are trying to move dynamically on this, meaning we're kind of pounding it, right? Then we get some of those forces going into tissues where they shouldn't really be. And so what I want to kind of go through here, guys, is really focus on the lower leg, right? Like how do we remove pain from our foot, essentially. The plantar fasciitis, again, is just that kind of catch-all phrase for pain anywhere in the bottom of the foot. And so the first thing we want to grab is our trusty orange ball. And I'm going to make this video in terms of like what you can do with minimal equipment, okay? So we're setting a timer. We're going to have like 10 minutes. We want to just attack this thing as best we can. The first thing we're going to look at, of course, is the bottom of the foot here. I'm not able to switch this around, I guess. So let's just take a quick look, right? What we want to be able to do is essentially get on this ball, okay? And what I would recommend is coming on over to a wall that you can kind of hang out on. Never mind the cute little booties there. And we want to get on this ball. And what I'm going to do, guys, first you can kind of see half that ball sticking out, right? And I'm going to set the outside of my foot all the way on the floor. And what I'm going to do then, guys, is essentially we're going to try to just drop that center of my foot down to the floor. And I'm effectively, right, really what I'm doing, guys, is I'm pulling these tissues apart, okay? So it's allowing me to kind of separate this stuff and kind of regain some of that functionality. The next thing we can do then is, after we've kind of smushed that out for several minutes, is now we can get into this ball, and I'm just going to stand on this thing. And what I want to do is I want to start maybe near the rear of the foot here, okay? And we're going to just work this thing all the way up and down. And if you find any kind of gristly hot spots, just kind of hang out there. So again, what I would do, kind of use this wall for balance, and I'm just going to kind of go back and forth. I'm going to start on the heel. I'm going to work my way up. And luckily, I'm not experiencing much pain right now, so tissues are okay. But if you're chronically dehydrated, if you're training a lot, if you're eating straight up paleo, and you're low inflammation, but you still have some issues in there, stay with them, really dig them out, okay? So that's the first part. The next thing we want to think about is in terms of, let's look upstream, right? So we're attacking kind of through the toe area here, up all the way through the heel. We just kind of mash that out. We separated that tissue. We're trying to get some pliableness back in here. It should feel very supple, okay? But the next thing we want to look at, of course, leads upstream into kind of this above the heel area, okay? And what we want to do is sometimes these cords get really tight, all right? So let's see if I can enter the matrix here and do this. What we're looking to achieve, guys, okay, is maybe what we can do is I want you guys to be able to reach up with your hand here, and you're going to kind of squeeze the skin at the base of your ankle. And then we're going to pull this apart, okay? Now, I'm just squeezing as hard as I can. I'm going to work from the heel up this heel cord here. And again, we're just trying to tack down those tissues. And then we're going to move through that range of motion as best we can. So if we've reduced range of motion, this is going to allow us to get some of that back. And after you stay with this for a few minutes, you're going to notice that this thing really starts to open up. I'm getting some good release here myself, okay? So we've lengthened, we've separated, we've softened. We're working upstream now to increase range of motion. So if you are not able to dorsiflex properly because these are so tight, right, you're going to just end up pounding on these tissues. So this is going to allow us to kind of reduce some of that pain up here. The next thing then, guys, we have to look at, okay, is going to be if we have any issues in terms of, let's say, the knee or the hip, okay? So if you can see me here, commonly if people have this sort of drop inwards, right, where let's say the arch of my foot kind of drops in here as I stand, well, now we're going to be pounding again on these tissues. And so we kind of got to look up at the knee and the hip. What are some things we can do to kind of open up and, again, remove any sort of limitations in our joints or our tissues? And so the next thing we want to look at is what we call this posterior tib, okay? So I'm going to get crossed here. And where we're going to look is going to be right behind kind of this shin bone here, all right? And we're going to take our lovely little ball, our myofascial release tool, and we're going to start behind, kind of posterior to this bone, right behind it. I want to just start down low, and I'm just going to kind of tack that tissue down, and I'm going to really twist it out. I'm going to grind it out. I'm already kind of feeling some good stuff releasing there. Again, a few minutes of tacking and releasing behind that tib, again, to release upstream of that foot. And I guarantee if you have plantar fasciitis, this is one area you're going to want to attack, okay? So that is what we're looking for there. Last but not least, guys, on the bottom side here, this stuff can also get very tight, and a good way to improve on then the other side is you're just going to start again with this ball, enter the matrix. We're going to put this thing right down on here, and now you can, again, just kind of tack that tissue down and work your way upstream. And I guarantee right in this region, whoo, we're going to find some hot business, okay? After all this is the most important part, you guys. You need to ice your foot. Total immersion. Draw up a cold bath, ice bucket with water, whatever you can. Cool those tissues down, okay? And then the last one, of course, if you haven't remembered back in the old day, right? Once we've cooled down the foot, now we can attack kind of the calf. So we're going to do our calf stretch. We're going to plant it up here, get that heel nice and close. And then we're going to draw this hip, try to get the hip over the knee, okay? That hip crease over the knee. We're going to contract and relax several times per leg, okay? So I hope this helps you guys with maybe some foot pain, some plantar fascia. Comment up if you have any questions. I'm really hoping we can reduce pain, empower you guys to keep kicking butt. Have a great day. We'll talk soon. Bye.